Did you know that the US has less than 5% of the world's population but over 20% of its COVID-19 cases? It's staggering,
Wow.
right?
Yeah, and I've heard our incarceration rates are just as shocking.
Exactly. The US holds about 25% of the world's incarcerated population. It's a
Incredible.
massive issue that's often overlooked.
So how do these two crises intersect?
Well, prisons and jails became hotspots for
Right.
COVID-19. The infection rates in state prisons were over 3 times higher than in the general population.
That's alarming.
Absolutely. And what's even more concerning is how mass incarceration reflects structural racism. It's
Yeah.
disproportionately affecting Black, Native American, and Latinx communities.
So the pandemic just made an existing problem worse?
Exactly. It's like shining a spotlight on systemic issues that were already there.
Mm-hmm.
Mass incarceration is a public health emergency.
And the public health community is starting to recognize that, right?
Yeah, but it's been slow.
Right.
The American Public Health Association only recently recommended moving towards abolishing carceral systems.
It's about time.
Definitely. But we need more action.
Yeah,
Epidemiology has largely ignored incarceration as a determinant of health.
that's a huge oversight.
It is. We need to adopt what some are calling carceral epidemiology, focusing on how
Interesting.
incarceration impacts health outcomes.
So what can be done to address this?
Well, one step is decarceration, reducing prison populations to mitigate health risks,
Right.
especially during pandemics.
But isn't that controversial?
It can be, but it's essential.
Yeah.
It's not just about releasing people. It's about investing in communities and alternatives to incarceration.
Makes sense. You're shifting the focus from punishment to rehabilitation and public health.
Exactly. And addressing the root causes like poverty and lack of access to healthcare, it's a
Mhm.
more holistic approach.
But how do we convince policymakers to get on board?
We need more data and advocacy,
Right.
highlighting the health inequities and economic costs of mass incarceration.
Yeah, numbers can be powerful.
Absolutely. And the pandemic has provided a lot of evidence.
Yeah.
It's unfortunate, but it's a catalyst for change.
So the key takeaway is that mass incarceration is not just a criminal justice issue, but a public health crisis?
Exactly. And addressing it requires structural changes to combat racism and promote health equity. It's all
Right.
connected.
Well, this has been eye-opening.
Definitely. Let's hope more people start paying attention.
Yeah.
Change starts with awareness.